Dundee's Telecare Service, an audio slide presentation by the Technology Enabled Care Group.
This is a dispersed alarm. It's central to every installation. It could work quite simply with a standard pendant for people who have been having falls. Pushing the pendant will then activate the dispersed alarm that will dial through a pre-programmed number to our control centre, alerting us at the control centre that there is an issue. Moving on from that, there's also a falls pendant that could be linked to the dispersed alarm. This is mostly for people that have got, say, dementia, capacity issues, that don't have the capacity to know to press the button if they've had a fall.
Okay, this is an epilepsy sensor. This is designed to go under your mattress and it picks up any rapid movement when people are having a seizure. Once it picks up rapid movement, it sends a call through to the community alarm box where it would come up through the control room, epilepsy. So the controllers would know that the service user is having a seizure and the controllers could contact the ambulance or the family if needed.
We also have a smoke detector, which could be linked up also to the dispersed alarm. The dispersed alarm could also be linked to a bed sensor, which again would be for people who are, have got capacity issues. We set times into it from 10 o'clock at night, for example, until 7 in the morning, with a 20-minute absence period. If they don't return back to their bed within that 20 minutes, it will automatically send a call through to the call centre, because maybe they've had a fall, or maybe just that they're taking a wee bit longer, but we can actually speak to them through the box once that's been alerted.
This is the Dta Pager. Again, this links up through to your community alarm. This is for people that are very hard of hearing. This is designed to activate, it's a pager that would vibrate if the smoke alarm was activated. When the service user goes to bed, there's a shaker here that goes underneath the pillow, so if the smoke alarm's ever activated, this will alert the service user there may be a fire in the house. Again, it would also come through to the control room and we could contact the fire service if needed.
We also have a door exit sensor for people who wander, maybe wandering out the building late at night. If they leave the house and don't return within a certain amount of time, this would then again automatically send a call through to our control centre.
This is a plug that's designed for people that are maybe forgetting to turn off the water in their bath or their sink. When the bath or the sink has so much water, this feels the pressure which would automatically release when there's too much water in the bath or the sink. So it's a good piece of kit. We don't provide them, but you can purchase them through Allardyce or from online.
This is a care assist. It's basically a handheld pager system. A basic pendant, a standard pendant, could be linked up to it to alert, say you have a service user lives with their partner, they live in two separate rooms. If one needs assistance, press the pendant. It can also be linked up to bed sensors, which will alert on-site carer or the family that the relative has got out of the bed and may be at risk of harm from putting the cooker on, smoking, or leaving the building.
This is a sensor beam from people that doesn't want any input from social care response service. This is to alert anyone who's maybe getting up and they're frightened, maybe their family member's going to go down the stairs. Whenever they cross this beam, it activates. I'll just show you how it works. You cross the beam, that would activate. If you ever feel that you were needing to have a referral for community alarm, which is social care response, you could go through Dundee City Council and get in touch with the first contact team, or you could have a referral made by your GP, district nurse, the warden, the hospital, but you can't self-refer. So once a referral comes through for community alarm, myself or my colleague Derek, who would go out and assess to see what kind of equipment may need. Not everyone needs a community alarm. If you've got very good mobility, never had any issues with your mobility, therefore you wouldn't need a community alarm. But we can suggest other types of equipment. The charging for community alarm is £2.85 a week. But if you've got been diagnosed with Alzheimer's or dementia, it's free of charge. Also, if you're over 70 and exempt from paying council tax, it'd be free of charge. But other than that, £2.85 a week, and you could pay that on a monthly basis or direct debit.
Thanks to Derek Kennedy and Pamela Mitchell of Dundee City Council's Social Care Response Service. You can ask your doctor or other healthcare professional about the Community Alarm Service, or you can call the Social Work First Contact Team on 01382 434 019.